and thanks for waiting us to get started. As you can see, we have a gallery of different faces joining us for this week's media briefing. Like to welcome you back after we took a little break from last week. But this is our normal briefing that features our county executive, Marc Elrich, our health officer, Dr. Travis Gales, and our director of the Office of Emergency Management and Homeland Security, Dr. Earl Stoddard. We're also joined today by Dr. Raymond Krall and also Dr. Bridgers. But you can see on your screen that we have a number of faces that you probably haven't seen before, and the county executive will kick off their introduction to you. But these are students that you will get to know a little bit later in our session. So without any further ado, I'm going to hand it over to the county executive. But before I do that, just remember, if you have questions, media, please place them in the chat so that you can be recognized. And also make sure that you list your media organization as well. So with that said, I will hand it over to County Executive Elrich.
So good afternoon, and thank everybody for joining us for our weekly press briefing. I apologize for being a little bit late. I was at a press conference supporting the Middlebrook tenants who live in the mobile park up there, who have just been struggling with their landlord and been presented with outrageous water bills and filed a lawsuit. And wanted them to know that we're supporting their efforts to get equity and decent treatment in this county, which is consistent with what we've been doing for many years now. I hope everyone had an enjoyable and relaxing 4th of July weekend and was able to celebrate with a bit of normalcy. I know we all missed fireworks, unfortunately, because there was no way of knowing that by the 4th of July, things would be as normal as they are. People did not go out and order massive fireworks displays, but I'm pretty confident that next year there will be the return to normal in that aspect of all of this. Today we find ourselves with a positivity rate of 0.48% and a case rate of 1.08 cases per 100,000. Currently, 68% of all our residents have received both doses of Pfizer and Moderna or a single dose of J&G, according to the CDC. We continue to lead the nation for our 12 and older population with a vaccination rate for jurisdictions over 300,000 at 80.6%, and that's 80.6% fully vaccinated, 89% with at least one dose. The group of folks who are over the age of 65 are 92% fully vaccinated, and 98% has received one dose. And that's just incredible for a population that has been so impacted by this. And frankly, a population as diverse as ours, to achieve these numbers is pretty notable. Another good statistics from the data this week is, and somebody just took my stuff away. Hold on a second. Gotta shrink this. I had notes and somebody just evaporated my notes I was working with. Okay. And the other good stat was that in our percent of eligible population over 18, 90% of them have received one dose. So that's pretty significant all the way around. I wanted to share with you a headline in the Washington Post that says, all Marylanders who died of COVID in June were unvaccinated. Unvaccinated. If you want to understand what the difference a vaccine makes, the unvaccinated folks are the ones who died. Vaccinated people didn't die. They may have gotten sick. They, may have had, some setbacks along the way, but they're alive at the end of this process. And what we're seeing is, and this is true around the country, that not being vaccinated just severely heightens your risk of more severe consequences. This week, we transitioned the Up County Regional Services Center for vaccinations. We closed down our Germantown, Mass vaccination site. We're continuing to pivot to bringing these services closer to people who need to be vaccinated. I'm very excited that we're going to be joined by some Montgomery County students who are winners of the PSA contest we sponsored. I want to thank you for your creative energies, and we're going to, I think, show you a sampling, maybe not because I heard there were technical difficulties of their winning PSAs, and I want to let the students know and give them an opportunity to share their thoughts with you. We had over 300 entries, and I encourage you to go online and watch them all. Not only do these PSAs help us message the importance of getting vaccinated to our younger populations, they're also incredible education opportunity for these students in video production, script writing, editing, and communication. So it's good all the way around, and thank you all for the work you put into creating these videos. Before we turn it over to students, there are a few other things we want to talk about. I believe people are aware that the governor's decision to end COVID-19 related unemployment benefits was premature and not in the best interest of the people of Maryland, and that was the ruling by a Baltimore Circuit Court judge on Saturday. I believe that the governor actually lost in 3 courts on Saturday, and their order to end the enhanced federal unemployment benefits has been restrained for the time being, and it allows hundreds of thousands of jobless workers in Maryland to continue to collect those benefits. We know that recovery from COVID appears to be quicker on the human end, but in the world of our economy, jobs just have not fully come back yet. There are too many stores that are still closed who used to employ people. There are employers who shortened their hours and are using reduced staffing. We know that residents aren't fully utilizing everything that was open as they did before COVID. There's a lot of caution in the community still, and I appreciate the caution. So until we get a higher rate of people employed, taking away their benefits and leaving them with Maryland's completely inadequate $434 maximum weekly benefit and $374 average weekly benefit is just not right. A person getting 4 of those checks would not be able to pay their rent in most places in Montgomery County. So we're hoping that the court makes this permanent, and I do hope the governor attaches things like this, as well as evictions, to achievements and reductions in the unemployment rate as a measure of people's ability to be back at work and be able to pay their bills. We want to let you know that in the area of housing, specifically affordable housing, tomorrow we're hosting a press conference at the Alpine View Apartments to discuss our efforts to preserve affordable housing. As the county grows, development pressures threaten our existing naturally occurring affordable housing stock at a time when we need to expand access to affordable housing, protect tenants from displacement. Park and Planning Zone study shows that over the next decade, the county could lose, they're estimating, up to 11,000 already existable affordable units could disappear. That's only going to add to the stress that people have and the shortage of affordable housing in this county. We need programs that focus on affordable housing. Market housing is not affordable housing, and it doesn't produce affordable housing. We need greater efforts in preservation, and we're very happy that the Alpine View property owners showed a willingness to work with us to preserve access to affordable housing and expand it to deeply affordable levels. At the end of the day, there will still be 564 affordable units, plus additional deeply affordable units, plus new market rate units on this development. It's a win-win for all of us, and I hope you'll join us tomorrow at 11 for this event and discuss this critically important issue. I want to remind people that tonight we have an update on our Reimagining Public Safety initiative. Tonight's discussion will launch a series of quarterly updates for this initiative, as I promised you the last time when we met earlier this year. The history of this initiative goes back before I made an announcement last July launching the Reimagining Public Safety initiative. After the shooting of Robert White and after a meeting on policing in the county more generally, we determined that we were going to seek more data from the department and that we were going to bring in expertise to help us rethink how we do policing in the county. We recognized before the murder of George Floyd that changes were needed, and I've been determined to make those changes. So please, if you get a chance, come to the event tonight, listen to what we're talking about, and help let people know that the county continues its work on reimagining how we do policing in Montgomery County. Lastly, I want to touch on the debate over the American Legion Bridge and I-270. Over the holiday weekend, the governor decided to go all out on social media to blame me along with our council and state representatives for holiday traffic on I-270, as if anything any one of us could have or would have done would have prevented the holiday traffic on I-270. It was a necessary and frankly an absurd political attack. We've seen this from his playbook before. It is not constructive. It's ironic because we continue to meet with his staff and discuss how we could move forward, and to launch into an attack like that when you're working with people is not the most productive way to try to achieve an end. The irony is the governor's argument is that his overly expensive plan doesn't solve the traffic problem either. And today, the Washington Post editorial that they wrote is absolutely dead wrong. It appears that no matter what I say and what our arguments are, the Post insists on portraying our message quite differently from what it actually is. So let's be blunt about this. Our solution is simpler, quicker, and cheaper for taxpayers and motorists. And while the governor claims that taxpayers won't have to pay for this, everybody who drives a car in Montgomery County and gets on the I-270 toll lanes, I believe, are taxpayers, and they will be paying for this, along with people from out of state and out of the county. But any Montgomery County resident using that is going to pay for it, and if you make it more expensive than it needs to be, you're just going to be paying more than you should pay. The county has supported 2 reversible lanes from the American Legion Bridge all the way up to Frederick. The Post falsely relates this to the interplay between a Republican governor and local Democrats, but nothing could be farther from the truth. The county's position is the same position that it had when Governor O'Malley, a Democrat, I will point out, proposed basically the same thing. And the council then said, we support reversible lanes. That was our position then. It remains our position now. It has nothing to do with the governor being from a different political party. We work with the governor on a number of issues. I don't care what political party he's from. All I care is where we can find common ground to work together. We should work together. But the only difference between O'Malley and the governor's proposal is O'Malley started in the north and ended his improvements on 270 at the ICC, and the governor started at the south and ended his improvements at the ICC. So when we looked at the governor's proposal, O'Malley, it was like you're going to speed traffic to the ICC, where we'll then go into an absolute paralyzing gridlock. And the governor is now speeding traffic from the south, which will then go into amazing gridlock when you lose 2 lanes at the ICC. It's already congested northbound all the way to Frederick without providing relief to the northern part of I-270. It not only doesn't help Montgomery County, it doesn't help Frederick either. So we want a comprehensive solution from the bridge to Frederick with reversible lanes and a rebuilt bridge with the capacity to handle it. We know that traffic is a killer in the AM rush southbound and in the PM rush northbound. But at non-peak times on I-270, few people would use the toll lanes because it's unnecessary. I drive this every day coming up to Rockville. There is not a traffic jam on I-270 going northbound, but I watch the cars backed up on I-270 going southbound, and there's definitely need for relief. Building reversible lanes, which is what Virginia's done on 95, means we get the same 6 to 8 hours of toll use out of 2 lanes that we get from building 4 lanes that the governor proposes. I can pretty much guarantee you that building 2 lanes is less expensive than building 4 lanes. And if you can get the same traffic benefits without the high costs, you would think that would be a win for Marylanders and a win for toll payers. So we're trying to come up with a solution that actually is important. I also want to make a point that, the governor talks about the soul-killing traffic on the American Legion Bridge. Well, the first time the governor and I talked about the American Legion Bridge, or not in his case, was in December of 2018. We were addressing a very large breakfast in Montgomery County, and the governor didn't talk about the American Legion Bridge. I got up after him and I said what I thought was pretty obvious, that if you're serious about traffic relief, you'd start at the American Legion Bridge. You don't start at the back of a traffic jam and think you're going to relieve the traffic jam. That bridge is a major plug in traffic. Fixing that bridge is a key to opening up traffic along I-270 and that part of the Beltway. I'm glad the governor changed his mind a month later, But I'd like to point out that that was not part of his original plan, and I had to suggest it. There needs to be a plan that also provides public transportation. I'm not saying, contrary to the Post, that we're proposing a public transportation solution that's a substitute. We clearly need more transit, and it would be very helpful if the governor followed Virginia's lead on the VRE and included the necessary enhancements to Marc that would increase its usage. There's a ton of traffic originating from Frederick in the west, and a decent bidirectional rail line would certainly help to bring commuters onto the system. And so it would not solve the problem by itself, but it would further reduce congestion. That, and along with support to the county in terms of relieving congestion on the roads that are fed by the ICC and the Beltway, would all lead to an improved congestion situation in Montgomery County. We continue to collaborate with affected communities, and we're hoping we can get to a positive outcome. Taxpayers are going to pay through this through tolls, and it's not going to be cheap. Our final ask to the governor was, we get when Trump was president why you wanted to bother to go to the federal government to ask for money for an infrastructure project, since that wasn't something the president was interested in. But now you have a different president, and you have a commitment to building infrastructure in this country. You have a commitment to build infrastructure at an unprecedented level. And in this corridor, you've got two major highways, 270 and 95, that are connected by a bridge, which is going to need to be replacement. And I could not think of a better project to approach the federal government for aid. And it's important because if we got aid from the federal government, it might not even be required that we do this project with tolls. And if Marylanders could benefit from a road improvement that didn't involve tolls, I don't see why we wouldn't be interested in at least finding out if that's possible. And of course, the legislature last week in their hearing demonstrated that the governor sidestepped the proper evaluation of whether or not a P3 was even needed. So there are questions about lots of aspects of this project, but we actually would like a solution. We continue to talk with the governor's aides about how we could solve this, and we do believe the traffic is a problem and the traffic needs to be relieved. But I'd like my residents in Clarksburg to get relief and not simply relief from the ICC South. So we will continue to meet with them. And with that, I'm going to introduce our student guests, or more properly, I'm going to let our student guests introduce themselves. And I look forward to your questions later. Thank you.
Hi, I'm Haley.
Go ahead, Haley.
Hi, I'm Haley. I am a junior at Northwood High School. And the message I wanted to share with my video is that I wanted people to know that vaccination is the key to ending the pandemic, and that we can save many lives as possible if as many people get as vaccinated as possible. And my motivation for making my video was knowing that I can make a difference if the people who view my PSA get vaccinated, and urge others to do so. And I learned from this experience that video editing is something that I enjoy, and I learned I am able to make a difference through my videos by sharing them with people and ensuring that they contain positive messages.
Hi, my name is Nathan Hahn, and I'm a rising junior at Richard Montgomery High School. I'm really glad to be here, and I urge people to take the vaccine. Thank you.
My name is Alvin Liu, and I'm a rising junior at Richard Montgomery High School. And I would like to thank Ms. Muneno and my friends for making this video.
Hi, I'm Ryan Whitaker. I'm also a rising junior at Richard Montgomery High School. I'd like to thank Mary Hill for giving us the opportunity to do this video, and also to encourage other people to get the vaccine, which is really important. It's going to help a lot of people in these trying.
Go next, because I think we lost Sophia. So the next person after Sophia.
Hi, I'm Christian Testa. I'm a rising junior at Richard Montgomery High School. And my group and I just wanted to create a fun and creative video to encourage more people to take the vaccine, because that's what's most important.
Hi, my name is Neha Ryan. I am a rising 8th grader at A. Mario Letterman Middle School. And my message is basically to show people that we can all be together as a community again if everyone takes their vaccines.
Hannah, I think you're the last one on our screen here.
Hi, my name is Hannah Clark. I'm a rising 8th grader at Farquhar Middle School. My motivation for making this video is that more people will get vaccinated and it will lead to, a result in herd immunity.
And we lost one student who had another appointment, Sophia Lee, who is a student at Blair High School. But before we jump into the rest of the agenda, I just want to give reporters and the folks at home an idea of what this contest was. As the county executive indicated, we had over 300 entries. We narrowed down those 300 to 30 videos that we looked through, and then we had basically 10 winners. We had 3 winners from the middle school level and 3 winners from the high school level, and we also had 4 honorable mentions. Our winner on the high school level was a young lady from Holton Arms. Her name is Sophia Hall. She actually is on a backpacking journey in Colorado, so she didn't have the connectivity to be able to join us here today, but her video was the #1 video that for the high school level. At the #2 at the high school level, second place, went to Khalib Collins, and he is a student at Richard Montgomery High School. On the screen with us, and his team as well, Christian Testa, was a 3rd place winner at the high school level. On the middle school level, our winner was Alan Burnell, and he also had a team that worked with him, and he won in 2 categories. His was a Spanish oriented video, but it was also our best middle school entry. Nahia, who's on the call, her team was the 2nd place winner in the middle school category, and the 3rd place winner in the middle school category was Hannah Clark. And Hannah, was Haley a participant in the production of yours as well?
Yes, she was.
Okay, so the Clark sisters came in 3rd. And we had 4 honorable mentions. I already mentioned one, which was the best Spanish language video. We had best animation, and Sophia, who left us, has had that one. Funniest went to Nathan Arriga, and best technical execution went to Haley Clark. So we will share these videos with you media so you can take a look at them. These students did a fantastic job, and we will be using those videos continually. The county executive and others talked about our vaccination rates being very, very good with students 12 and older, but there's still room to get others. And these videos were designed for kids to talk to kids. So we'll be using those out on social media, and you'll be seeing them around, and certainly support these kids in their wonderful work. And we want to thank all of you all for being here today. I'm going to hand it over to Dr. Gales to give us an update on the health statistics, and then over to Dr. Stoddard following that.
Good afternoon and happy Wednesday. I don't have a ton of updates beyond what the county executive has mentioned already. He laid out our community transmission levels, and would like to just highlight the vaccine numbers that he referenced in one of the highest performers in the country. When we look at our total population, meaning everybody, we have fully vaccinated 68.4% of our residents, and we've provided at least 1 dose to 75.5%. Again, this is the total population, including those who are under the age of 12 and not actually eligible to get the vaccine. When we look solely at the individuals over the age of 12 who are eligible to get the vaccine, we have fully vaccinated 80.6% of the population and have provided at least 1 dose to 89% of those 12 years or older. The last statistic I'd like to highlight is when we look at those who are over the age of 65, which receive the most attention due to the increased vulnerability based upon age, we have provided at least 1 dose to 98% of those residents and fully vaccinated 92.2% of that population. Again, I would like to say congratulations to all of the students who participated in the video contest. Thank you for your efforts, but to pick up on something that all of them mentioned, they encourage people to get vaccinated. The reason why we continue to encourage folks to get vaccinated is because we know the vaccines work. They keep you and they keep your family safe and healthy and prevent transmission. And this is continuing to be important as we continue to see the impact of variants. There is evidence when we look at other places in the United States, we don't have to look overseas, but when we look at other places domestically, where we see increases in cases right now are in places where vaccine uptake has been significantly lower. And as was pointed out, I believe 100% of COVID deaths in June in Maryland were in individuals who were not vaccinated. And nearly 100%, I don't believe it's all, but nearly 100% of new cases of COVID in the state are also in individuals who've not been vaccinated. So the numbers are clear, and support the case what we've been emphasizing all along for the last 6 months now since the vaccines have been available. Get vaccinated, protect yourself, protect your families, and the higher numbers we can get in terms of vaccination, the lower we can continue to drive our community transmission levels, and the more comfortable and confident we can feel in furthering our reopening of society and returning back to normal. Thank you.
Good afternoon. I have just a couple comments to add on, and actually, as the county executive said, 100% of the deaths. It was 95% of cases in the state of Maryland in June, and 93% of hospitalizations were due to were from not unvaccinated residents of the state of Maryland. So obviously that provides some great support for the notion that folks should get vaccinated. As you know, today or yesterday, actually, we opened up the Up County Regional Service Center to serve as our Up County regional site for vaccinations, transitioning away from the Germantown Montgomery College campus. We want to thank the college. We want to thank Holy Cross Health for working with us, as well as all the volunteers that supported that site, and we'll continue to support the other sites that Dr. Gales alluded to, particularly the Up County site. Just so we have had some people show up at the Montgomery College site. We do direct them over to the new site at the Up County Regional Service Center, but as much as we can get that message out there so people realize the site has shifted, that is tremendous. We ended up vaccinating doing just short of 75,000 shots at the Germantown Mass Vac site before it closed on Friday. And so obviously that was a great triumph for the county and all of its partners. And frankly, we want to thank our residents for coming out and getting vaccinated in such large numbers. I think those are all the things I wanted to highlight today, and I think we can get to some questions.
Okay, and before we get to our question, I just want to give Dr. Krall one moment to say thank you, and we want to thank him for his department sponsoring the video conference.
Thank you, Mr. Hudson. I appreciate it. And I would just a moment to say to each of you all who participated in the video PSA conference contest, what an excellent and outstanding job you did. I deeply appreciate all the work that you did and all the time and energy and creative thought that went into producing those PSAs. We are still, as everyone has said this morning, not out of the woods yet when it comes to this coronavirus, and getting everybody we possibly can to get vaccinated is still very, very much important. So no matter how well we're doing, there's still more room, and your PSAs come along at exactly the moment where it may make the difference between someone sitting on the fence and deciding to jump in and go ahead and get vaccinated. So I thank you again from the bottom of my heart and on behalf of the Department of Health and Human Services for your work. I appreciate it. Thank you, Barry.
You're welcome. And to our first question comes from Kate Ryan, WTOP.
Bear with me. As always, struggling with the mute buttons. Kids, I don't know how you did it all year long. I did want to address my question to the students, one or two of the students. I know there's not a lot of time here, but when you, let's start with maybe Hallie, when you came up with your PSA pitch, what would you say to, what was your argument in that to convince people to get their shots? And what would you say to adults who are still going, I don't know, I'm worried about those shots? Hallie, do you have an answer for me on that?
Well, my pitch was more don't do it just for yourself, do it for others, because a lot of people, they just think about like themselves when they get vaccinated. But if you get vaccinated, then you could also be saving someone else's life, because you have a less chance of spreading it to someone else. And so that was kind of like the message I wanted to share, that you should get vaccinated so you can also protect your loved ones. Like if you don't want to do it for yourself, do it for the people you care about.
Good for you. And Nathan, can I direct the same question to you? What was your pitch, and what would you say to people who, again, congrats to the 12 plus, because your vaccination rates are pretty astounding. But what would you say to an adult who's still like, I don't know about that shot?
Just like Haley said, definitely get vaccinated. If not for yourself, for others. Like you said, the rates are climbing super fast, and it would just be wonderful if we can stop wearing masks again.
And Christian, I'm going to ask you a last question for the students, I promise, because I don't want to take everyone's time. But Christian, I wanted to ask, in terms of, has your life changed because more people are vaccinated? Are you seeing a positive effect? Like, hey, when we're all vaccinated, I get to do what?
Yeah, so I would definitely say it's not like a sudden change. Like one day, my friends and I are at home wearing masks, and suddenly we can all meet up again. But definitely over these past few months, I've seen a really high rate of like going back to normal, where a lot more friends are meeting up, a lot more people are able to see each other outside. And I just noticed a generally higher social like aspect to this summer than there was last summer. And it's definitely made a big difference very recently.
Thank you very much, guys. I'm a former teacher myself. I see RM is very well represented. I'm going to ask my former colleagues at QO what happened. But if I could, Dr. Gales, I do have a question for you. In the summer session of schools right now, the directive is apparently that students in those classes for summer will be wearing masks. Is that something that is a recommendation from your office? Do you see that changing? What is that status right now? Can you help us understand?
Thanks, Kate, for your question. If you reviewed last week, I did put out a list of recommendations related to face coverings that have been consistent with what we've talked about pretty much over the last month. And as it relates to the school system and places where children frequent, including schools and camps, the recommendations that were put forward from our office were consistent with the same recommendations that were put forward by the American Academy of Pediatrics, with the express purpose, again, of maximizing protection for those children who aren't yet eligible for the vaccine. And to kind of maybe anticipate a second question that you may have, as it relates to what the fall may look like, those conversations are ongoing. And I know that the school system is also looking at what other jurisdictions are doing. And we're also continuing to see if there will be any significant changes in our community transmission levels due to the impact of variants that we've seen in other places. So stay tuned for that. And as we move further and get closer to the school year, the fall school year, those same types of recommendations would be shared with the Board of Education as well as our non-public school partners, so that they can make the necessary determinations for their students and staff in the fall.
Okay, I don't see any additional questions.
I'm sorry, I did have another.
Okay.
Sorry about that. I wanted to follow up with the county executive on unemployment and also the 270 situation. When the TPB gets together, some of those members have changed. Frederick shifted some of the people who will be voting on the 21st. Do you have concerns about that? And then secondly, the Hogan administration has said, we gave Montgomery County everything they wanted in this latest iteration of the plan, and you're shaking your head. Can you talk about that? You're on mute.
You're muted, Mr. Executive.
My first comment is, what's a good word for that's not true? Look, we said from the beginning, they should start at the American Legion Bridge. That was not the governor's idea. Then we said we supported reversible lanes. We have said it over and over again that we support reversible lanes, which has nothing to do with the governor being a Republican and trying to stymie that. It is our position that goes back to when O'Malley proposed the same thing on 270. We believe reversible lanes work. They work because if you know Montgomery County's history, and if you look at our future planning, we do not have bidirectional massive congestion on I-270. We have a terrible problem going south in the morning, and it starts in Frederick and it goes all the way down to the American Legion Bridge. And we've got a problem in the evening that starts at the American Legion Bridge and goes all the way up to Frederick. This has always been the case. 2 lanes that run south in the morning and then run north in the evening give you the same 2 lanes he would give you, but it gives it to you at the time you need them. So you spare yourself building 2 lanes that you don't need 20 hours a day. It doesn't make sense to spend that much additional money in a time of scarce resources when you don't need it. And so we've been consistent about this. We continue to work with the state. We think that there's a way to get there. I look at this road all the time and try to figure out how to make this work. I suggested 3 years ago that the governor paint in another lane. They could have another lane tomorrow on parts of 270 if they just took the inside service lane and turned it into a through lane. Most roads don't have inside service lanes. The Beltway doesn't have inside service lanes. Most of the time there's a narrow strip on the inside and it's the outside that has the service lane. There's so many ways to do this. And frankly, part of me wonders after all this going back and forth, whether this has become more about a P3 for the governor, or is this more about traffic relief? Is he worried that doing a project that's too inexpensive or not sufficiently expensive, that it wouldn't be attractive to a P3 owner? I don't know. But ask me why he doesn't go to the federal government and say, this is a perfect candidate for your infrastructure program. Maybe they say no, maybe they say yes. If they say yes, we could probably do this entire thing without tolls. And what would be better for Maryland citizens than not just no taxes, but how about no tolls? Traffic relief is possible. We fully believe in it. We're going to continue to work on it. But there's things wrong with the way the governor's gone about it. And if you followed the legislative hearing that was held last week, they pointed out that the governor didn't even follow what were supposed to be requirements that the P3 be evaluated versus a non-P3 to see if it was even necessary. I'm not even talking about that. I'm just focused on the mere traffic aspects of this. Is we could solve this for less and we ought to do it. And I'll declare victory. He would get credit for actually coming up with the proposal to fix the, as he would say, soul-crushing traffic on I-270. And I'd be happy to thank the governor for having had the willingness to take this project on and see it through.
Are you concerned about the makeup of the TPP board for the next vote?
Yeah, I'm worried. I'm worried that he's threatened jurisdictions and basically holding them hostage and telling everybody what projects he's going to kill. I would hope that my colleagues remember he's not going to be there more than another year and a half. And so he can do whatever he wants for a year and a half. Capital projects are long-term investments. I'm sure if he can't wrap his head around doing something, that a subsequent governor, Republican or Democrat, will be more likely to try to figure out a reasonable accommodation and, by the way, provide services to residents in the other counties. I'm kind of shocked that he's taken this scorched earth approach of that I will wreck everything in my path of anybody who opposes me. I don't get it. Most of us don't do business that way.
And then on the unemployment.
Hold on. Kate, can we come back to you? I do have another question.
Absolutely.
Okay. Steve from Bethesda Beat.
Afternoon, everybody. Kind of localizing going to vaccination rates. Biden's administration set a goal of 70% by July 4th, and we just fell short of that nationwide. For health officials, obviously we're at a point where, supply is not an issue. It's convincing people to get it. Is there, by the fall, winter months, is there a number we want to hit, as simple as that sounds? Is it more just inching forward and kind of increasing what are y'all's perspective on that, I guess?
So Steve, great question. Dr. Gales had to jump off the call to return to a Maryland Department of Health call with the other health officers, but we will continue to move forward. We will continue to assess our vaccination strategies and identify those targeted areas, and working with our community partners as we've done in the past to increase our vaccination rate. We have been discussing all along the range or the targeted percentages that we need to achieve herd immunity for the entire population. We've made significant progress, and as we continue to look at vaccinating those unvaccinated individuals and those unvaccinated categories of under 12 years old of age when a vaccine becomes available, we will continue to make those assessments and move forward. That's the sum of our approach right now and looking at achieving. We continue to have our community engagement, great student input, and we continue to look at strategies that will increase and ensure our best practices to achieve those numbers that we are reaching for.
So, I mean, obviously 100% frankly probably an impossibility, but herd immunity, I think, is somewhere between 85%. Obviously, correct me if I'm wrong. Is there a number, though, in terms of, we'll hit this by X date or by the end of the year, we'll be happy? Or is it, I guess, is there, in that sense, is there a magic number, or is it just hopefully we continue to prod away at this?
There is no magic number, Steve.
Okay.
Our focus is on consistency and targeting, and so we've been consistently moving along to vaccinate higher numbers, and we continue to do an assessment and be consistent. We don't want to drop off. The message is clear. We need to vaccinate those who are unvaccinated, and that's pretty much the sum of our approach.
Yeah.
Let me go ahead. Sorry.
Yeah, I was going to add, Steve. So right now, of our population, about 87% or so is eligible for the vaccine. There's still 13% who are under the age of 12 who are not eligible, rough numbers. And I think that obviously for us to get to the quote unquote herd immunity numbers, 80+% that we've talked about across the whole population, it's going to require that those other populations, at least a portion of them, become eligible. Just monitoring the Pfizer study as an example, I think they're talking about the data coming in for 5 through 11 in the September timeframe. And so obviously that would mean that this fall we'll be doing vaccinations for a younger group of people, presuming that those results come back positively. And obviously that would, that next grouping and plus what we can do still within the groups that are currently eligible will start to creep us up potentially towards that 75, 80% number where we're talking about. But I think the key thing here is that the target is going to keep changing, because as we've seen with Delta, the number you need to achieve for herd immunity changes with the strain that's spreading. And so the more transmissible the virus is, the higher your threshold needs to be for herd immunity. And so I would hate for us to say, let's get to 80%, then have a variant come along that requires a herd immunity number of 87% or 90%, and we've now set a target that's inappropriate. And so we're going to keep pushing to get people vaccinated, as many people as we possibly can. I saw with the governor's announcement at one, he's having a scholarship program for ages 12 to 17 for people who get vaccinated there. Anything we can to encourage people to be vaccinated, we're generally supportive of. And so obviously, certainly amongst young people, we've seen the rates be a bit lower than certainly our 65 plus population, and we'd like to continue to encourage that group to get vaccinated.
On that note, on the Delta variant, any of the health officials can answer this, but is there, obviously we've seen other places around the country where this is starting to be a little bit of an issue. What, I guess, are the warning signs in terms of, hopefully this variant doesn't spread too much? I mean, I hate to be repetitive, but is it a magic number? I guess, what are some of the warning signs you're looking at when it appears like that's the one that, at least for now, is the danger? I mean, might be a strong word using danger, but you get what I mean.
And so Dr. Gales indicated, Steve, again, a great question. Looking at hospitalization data, Dr. Stoddard and I mentioned this early in his presentation, looking at hospitalization. rates, look at the transmission rates across the region to see if there's any migratory or trends heading our way, or assessing those trends in the area. Clearly, we want to look at those unvaccinated folks, which we talked about, and that's pretty much the principal target right now, because we know that those unvaccinated populations are the most vulnerable. And so as we continue to look at and look at the trends and look at the data, we focus our strategies in those areas where we know we can mitigate any further transmission of the Delta variant. But again, it's a sampling that's done by the state. And I'd like to also add that we continue to test at a high rate. So we're also testing, and we're providing samples to the state labs, to our hospital labs, so that we can trace any of the variants or their lineage based on community transmission rates. And so we look at the data and we determine whether or not there's any trends. And that's how we continue to make the assessments, monitor the assessments, and inform the executive leadership.
I think B117 remains our most common variant. The formerly known as the UK variant is the most common type in Montgomery County still. I think following the guidance of our national experts, I think the Delta variant will eventually take over everywhere in the United States. It's doing it faster in places with lower vaccination rates, as you would expect. But I would expect the dominant strain in the United States to become the Delta variant over the next several months. Just, that's not me saying that. That's me listening to people who know more about these national and international trends than I do. And so we expect that will eventually happen, even in Montgomery County. We're just hoping that our vaccination rate is so high by that point that it will represent less of a concern for our residents than it might in other places where the vaccination rates are much lower. And so that's why we come on these briefings every week and start off, finish off, and everywhere in between, encouraging people to get vaccinated, because, it may seem that you're protected or insulated by your neighbors now, but that may not be the case when the transmissibility of the Delta variant or some other variant we haven't seen yet comes along. And so obviously, it's sort of, we're really just encouraging people to, as the governor is saying in his 1 o'clock briefing, as we've said many times, it is clear the vaccine is very effective. There's no, doctors are getting it. There are other people out there who are recommending it be gotten besides just the governments. And so please do heed that warning and don't wait for the strain that's going to come along and get you to make that decision.
Quick follow-up, what's the latest? I know, especially the Pfizer vaccine, I think there's still debate on how effective that is against the Delta variant. And, it might not be perfect compared to, this original strain that we've been battling, but what's the latest any of you have seen from the literature on that front, I guess?
There have been 2 studies that have been reported on over the last week. The one that got the most fanfare was the Israeli study that was published, I think, earlier this week. I want to say Monday, maybe it was late last week, that said essentially the Pfizer vaccine is approximately 64% effective against the Delta variant. However, there was a study from Canada posted, I think, several days within about 48 or 72 hours prior to that said that the efficaciousness of the vaccine was probably in the 88 to 90% effective range. And so there's a big difference between 64 and 88 in any math scale that we utilize. And so we're sort of just paying attention to the literature and trying to follow along to understand. I don't think we have any better data to suggest it's more or less effective. We're seeing very low rates here in Montgomery County, and we've got a lot of people with, principally the mRNA vaccines from Moderna and Pfizer, with some number who have gotten Johnson & Johnson, and our rates are very low. And so obviously we're paying a lot of attention to it. I don't know that I don't put any more stock in the 64% than I do the 88% number, but whatever the number is, I think we're going to be paying attention and trying to get more people vaccinated. And 64% is a whole lot better than 0% as well.
Thank you, everyone.
Kate, did you want to come back around with your question before we close out?
Yes, I just wanted to double check again on the unemployment. The case will go back to the Baltimore City Court. The Hogan administration has said they're confident that they will prevail there. Mr. Elrich, I'm curious as to your thoughts on that.
I hope their confidence is misplaced. They were confident that they weren't going to lose the first round. So we'll see. I'm hopeful that the judge will look at this and realize it's federal money for a purpose that still exists. The federal government understands this money needs to be put out. The governor is making a decision that assumes a level of employment and a level of job availability that just isn't out there right now. And it's not his fault or anybody's fault. But the reality for people is the jobs aren't back. And when the jobs are back, this should go away. Maybe the state should think about more reasonable levels of unemployment payments, but that's a different issue. But I'm hoping he's wrong. It'll be a sad day for these folks if he's right.
Got it. Thank you very much.
Can I just add real quick to that? I'm not a lawyer. Don't play one on TV. Don't even pretend to try. But having read some of the materials and had read the ruling from at least one of the judges this weekend, there's two elements that they assess. Number one, it's impact, which clearly it's easy to demonstrate. People who are losing the benefits or the extended benefits are going to see a real impact. But also the other factor in issuing this temporary restraining order is a likelihood that the claimant will be successful on the merits. And if even if you can show harm, if you're not likely to be successful, they don't issue the temporary restraining order. So at least the judge in the first three cases has viewed there being a reasonable level of success for the plaintiffs in this case. And so I'm not a lawyer. I don't pretend to be an expert. I think the county executive is exactly right. But it seems that a judge agreed that there was some likelihood of success on the merits of the case. And so I'll defer to their judgment.
Thank you very much.
All right. I think that's it. Any more questions from the media? Going once, going twice, 3 times. Want to thank all of you all for joining us today. And before we go, I do want to again give a shout out to Dr. Kroll and his agency for doing this video contest. A special shout out to Lynn Cook, who led this effort and communicated with a lot of the students working with HHS on this, as well as Mary Anderson and Mara Parker, and of course, all of our judges who judge these videos. We will get out to you all the videos so you can take a look at them. And I want to once again acknowledge the first place winners in the junior high, in the middle school and high school category. The high school winner was Sophia Hall from Holton Arms, and the winner from in the middle school category was Alan Burnell and his team, and they are from Eastern Middle School. Thank you very much to the students for being here today. And as Dr. Stoddard said, these students are an example of how important it is to be vaccinated, and their message to us as adults and certainly to their friends is get vaccinated to protect everyone. So thank you very much for being here, and we'll see you next week.